when a private equity company purchases a hospital, a nursing home, or a emergency services, they cut nurses right away. They cut the staff. There's an increase in patient falls, an increase in wound infections, an increase in blood-borne infections, and an increase in adverse events following a medical or surgical procedure.
Kathy's worked mostly in hospitals in every department: medical, surgical, pediatrics, labor and delivery, emergency room, ICU, operating room, locked psychiatric units, and chemical dependency units. She is a board-certified holistic nurse, a retired healing touch instructor, and a somatic experience practitioner. She served on the faculty of Beyond Ordinary Nursing, where she taught integrative imagery to nurses, and she's the founder of Gutsy Nurses, a program designed to help nurses recover from burnout. And she's author of the upcoming book, Gutsy Nurses Save Lives. Without any further delay, here's Kathy. Hi, Kathy. Welcome to Tales from the Shift. How are you?
Thank you. I'm fine. Thank you for having me. I'm really, it's an honor to be here with you.
It's an honor to have you. I think nursing is definitely a noble career. I think what you do for people is great. It's fantastic. I know that. I mean, I can just imagine being, I'm sure we'll get to it, but I'm sure you've been in situations where you're with somebody who is alone and it's the end for them, and I can't imagine what that would be like. It would be very, very difficult and so very noble of your profession, for sure.
Well, thank you. It's been very satisfying.
Good. I'm glad to hear it. All right. So, as I said in the preview before you even came on the show, you've worked in essentially every department that would require a nurse. Yeah. So, whether it's, medical, surgical, pediatrics, the ER, psychiatric, why don't you just give us an overview of what being a nurse is across these departments, what it's like to have this job?
Well, I had the opportunity to be in a school that was a hospital-based school of nursing, where we worked half day in the hospital and half day were in classes. And so for every single department that we worked in, we also were studying about that kind of illness at the time. So it prepared me to work in every department. Now, when I first became a nurse, I was a volunteer nurse in a very small 30-bed hospital, and I was in charge of the entire hospital. And we had one room for pediatrics. We had a bunch of rooms down that same hall for medical surgical patients. The operating room, we scrubbed in for surgery in the daytime. And then labor and delivery, newborn nursery, the emergency room. We covered everything that community needed. And my education prepared me for that. And I had wonderful nursing aides who were able to help me when I didn't know something about the language, because it was a new language. It was in Taos, New Mexico, and a lot of the people spoke Spanish, and I didn't understand. So I learned enough Spanish to say, voltease, which is turn over, and then I'd show my syringe, or tiene dolor, are you having any pain? So I wasn't very good at it, but I had help.
Okay. So when you say when you went through training, so we'd call that a teaching hospital?
Yes, they had.
What was the name of it?
Well, it was Providence Hospital School of Nursing in Detroit, Michigan. And in those days, this is a very long time ago, in those days, the 3-year schools of nursing were very popular. And I had 2 aunts that had gone to a 3-year school of nursing, and I wanted to do the same thing. So, yeah, they had an incredible training program there, incredible education program. So I was very lucky. So, want me to tell you a little more about the hospital? The hospital was built, it was one of the oldest hospitals in Detroit. It was built in 1910. And they didn't have any of the things that you have in hospitals today. There was no piped in oxygen, no piped in suction. They didn't have no people weren't on monitors. We didn't have monitors then, so it was a real basic experience. We used other things besides piped in suction. We had suction machines. We had oxygen tents with those big, tall, metal green oxygen tanks, and had to make sure nobody's smoking on the floor. Nobody's smoking on the unit.
Yeah. So what year are we talking?
We're talking about 1961 to 1964. Okay. It's a long time ago. And healthcare has had some incredible changes since then. So, yeah.
Have you seen the show The Nick?
No. Tell me about it.
It's about the Knickerbocker Hospital in New York, and it's set in 1901, I think. And essentially a lot of the things, so you're talking about, they were just starting there. They did a lot of inventions there, a lot of research. Like, I think what you were saying, the pumping, that was, they were working on that. They were working on a lot of it. It's a really great show.
Great.
They just invented electricity, so now they're trying to get electricity into the building and deal with all that.
Well, I'll tell you, with my hospital, it was built in 1910, and there was no air conditioning, and it was heated with coal, and they would come and drop off the coal in this building behind the hospital, and then the heat would be sent to the radiators in the hospital. And then for air conditioning, you opened up the window. And I will tell you that when I was working in the operating room, this is in Michigan, it was 105 one week when I'm working in the operating room. We had to have 2 extra nurses in the operating room, one to wipe the sweat off of everybody's brow so we wouldn't drip on the instruments or on the patient, and the other one to kill any flies that got through this big screened-in window into the room.
I thought you were going to say we had to have one in case one of the nurses passed out from heat to replace
nobody passed out. I think when you live, like you live in Chicago, when you live in the Midwest, you get used to the weather. And this is before really a lot of air conditioning, so people were pretty much used to it.
Yeah. I can imagine.
I had a doctor tell me, I had a doctor who was a resident at the University of Michigan, and he told me, he was from California, and he said, how do people even think in this weather? And we're going, what do you mean? This is fine.
Yeah.
So you adjust to your circumstances.
Yeah. Okay. So backing up just a little bit further, why did you decide to become a nurse? Maybe you answered at the beginning. I didn't quite catch it.
I didn't really answer it too much. I'll tell you, I always wanted to be a nurse. I'm second oldest of 9 kids, and my mother ran a daycare. And I'm very good at anticipating needs and finding solutions. And so I thought being a nurse would be much more interesting than being a secretary. There's so much more interesting things to do. Or being a receptionist. I mean, I could care less about sitting all day and typing. So I decided to be a nurse. I would imagine
being the second oldest of 9, you probably did some nursing already.
I did. Yeah.
Very cool. And so you stuck with this career the entire time. There was was there any time you said, I think I'm going to leave this? Or
no, I love nursing. No, I may have decided to leave the department that I was working in for a different department, but still as a nurse.
Okay. And then currently, how would you say what's the main route that people go through to become a nurse right now? They just pick up.
There's a number of different routes that people can take, depending upon what they want to do. Some people want to be a licensed vocational nurse, also known as a practical nurse. That training is a 1-year education process. And then people who want to be an RN, they have multiple choices. One is to go to a 3-year school of nursing, which there aren't very many of those, but there are some. Also to go to a associate degree program, which is a 2-year program, usually taught at community colleges. And you get a lot of hands-on experience in the 2-year associate degree program. Some people would rather go just straight to get a baccalaureate in nursing. And those are usually at the university level. And
what would be the advantage to doing that?
Well, they say the advantage of that is that you're more trained to be an administrator. I never really wanted to do that. I always wanted to do bedside nursing, and I ended up
Yeah.
being in charge, being in not a hospital administrator, but also being in charge of the units where I worked. So that's a possibility for some people, is to go to a baccalaureate program. There are a lot of nurses who get their baccalaureate and they want to go in for a master's. And so that's another 2 years. And then there are nurses who have gone for their PhD in nursing. Those are more educators, researchers, writers.
Okay.
So,
So let's talk about work-life balance. I would imagine it's not fantastic, but what is the work-life balance as a nurse? And I would imagine, depending on department, how would that possibly be affected?
well, I can combine this with another question that you asked, which is, what's so brutal about nursing? And the thing of it is, in today's world, it's very, very terrible work-life balance, because they sold the change in nursing to nurses as, gee, how about working 12 hours shifts, and then you only have to work 3 days, and then you've got 4 days off to rest. That is not the norm today. Nurses are working 4 and 5 day, 5 hour, or excuse me, 12-hour shifts. So when you're working 12 hours, you've got time to get to work, time to get home, very little time to see your family. It's very isolating, and
Yeah.
it's very, very exhausting. So it's not good today. And also
Yeah.
I just want to say, although it's not good, and it's very harmful for nurses and I think for patients, there are enough people who are fed up with it that I do think the system will change.
Really? Okay.
Yeah.
And I think we'll get into that a little more depth
Yeah.
later about the
Okay.
system and healthcare and all that stuff. What about money? What does a nurse
Well,
normally
it
make?
depends. The income depends on what department that you're working in. What we're seeing today is there are travel nurses, and those nurses usually go when there's a strike, and they'll usually work at that hospital. And they're called in to fill in until they get enough paid staff, and they make a lot of money. They can make as much as maybe $2,000 or $3,000 a week. So that's pretty good. So, but they don't usually stay at the same hospital. They go to other hospitals. Depending upon where you work, some nurses are paid hourly, anywhere from $60 an hour to um, 45 to $50 an hour. If you're a nurse recruiter, if you're home health, that's 60 to 61. Um, a clinical educator makes usually around $100 an hour. Case managers can make up to $122,000 a year. Behavioral health nurses usually are making around $83 an hour. So, like I say, it all depends upon where you work. Now, there are some nurses who are school nurses. They don't make that much money, but school nurses have their weekends off. So that's a positive. And
Right.
then they want to work with children. So that's great. Um, so there's a lot of different uh, opportunities. I would say that if you just want to go into nursing for the money, that's probably not a good thing, because it might not keep you there.
Do you think they're underpaid for what
No,
they do?
no,
Oh,
I don't.
okay. All right. So let's talk about relationships between nurses. Do you tend to, is it tend to be a supportive thing? Is there any
Well,
competition,
it's
toxicity, or
no,
anything like that?
no, it usually is very supportive. Usually nurses will work together. But in today's world, I have to tell you that the for-profit industry has, the first thing they do to make more profits is they reduce the number of nurses that are working. So that means that nurse has too big of a patient load. And I'll give you an example of that. A friend of mine was working, and she was responsible for 5 critical patients. One of the patients got into was what we call going south, was getting into some trouble. So she found the nurse's aide to see if the nurse's aide could help her. And the aide had 13 patients of her own. Now, this is in the hospital. You don't get hospitalized unless you're sick. So that's very, very stressful for nurses,
Yeah.
extremely stressful. And so for a nurse who's overwhelmed and way too stressed out, that nurse might be more irritable and might start bullying or reacting to her fellow nurses. And it's totally understandable. And I personally think it's situational.
Yeah, and I would imagine. So, okay, so I remember there was that movie, Young Doctors in Love.
Uh,
So I'm picturing nurses are there all the time, doctors are all the time. Is there any romance things that start popping up in the
Well,
workplace?
that's really good for TV. But in the real world, people are working their butts off and they don't really have time. I mean, there may be people who are attracted to each other and they may express that to each other, but there's not really time to really do much about that
Yeah,
on duty. That's for after duty when they can hook up with each other.
whenever they
Yeah.
have
Yeah.
some after duty.
Yeah, right.
Yeah.
If they can make the
Okay.
time.
Okay. Um, who would you say nursing is for? Who would you say nursing is not for? Who is it for? Who would you say, you know what, don't bother?
Well, the thing of it is, I think bedside nursing is definitely not for people who don't want to work at the bedside, but there are lots of other departments and places that this person could work if they don't want to work with patients. Um, there's the utilization review to make sure that everything was carried out the way it's supposed to be. You can work in a blood bank. Um, you can work, see, let me find my list here of all the different places people can work. Anyway, there's a variety of places where people can work besides the bedside. My sister, for a while, worked with billing for insurance companies to make sure the bills were accurate, because sometimes those bills aren't always totally accurate.
Right.
So that was something that she could do. There are nurses who become legal nurse consultants, where they work with lawyers to help lawyers on their cases to be able to understand what the proper protocol is, what the language means, all of that. So that would be good for someone who doesn't want to be at the bedside. So there are lots of other opportunities besides just working at the bedside.
Okay. So sounds like what you're saying is there are so many nurses and so many types of nurses that really it's just a matter of finding your niche
That's
that
right.
that you fit into, and so there's a little
Yeah.
something for everybody.
Yeah, right. Exactly.
Very cool. Okay.
Exactly.
Okay. If you could change anything about nursing as a profession, is there anything at all?
Yes, absolutely. And this is, nursing is part of the healthcare system. The healthcare system is a for profit system designed to make money. And what I would do, and because of that, they have reduced the amount of care that people are getting. So I'll tell you, the average length of stay for a hospital stay is 2 days. You're in and out. And the average, or not the average, I will say, for many surgeries where people used to stay for a few days to make sure they were okay, they're discharged maybe after 2 hours coming out of surgery when they're just coming out of the anesthetic. And
Yeah.
so the problem is that nurses are hospitals are reimbursed for um, procedures, for tests, for lab work. They're not reimbursed for care. So care is included in maybe the hospital rate for each day. So what they do to try to save money is they get rid of the nurses that you need to take care of you. So that's one thing I would change is I would change to bring the nurses back to give the care. And nurses today are really more like data collectors, and that really doesn't feed the soul of the nurse or of the patient, and it's not really good for long-term healing. So yeah, I would bring back the care.
Okay. So you would say that they want to get the person out of the hospital as quick as possible,
Right, right.
having
Because
done the
once,
tests and things they need.
yeah, right, after they've
But
gotten the money they can get from them,
but
then
the
they're gone.
chance that
Huh?
but kicking them out early, would you agree, increases the chance of something going wrong now,
Absolute.
not at the hospital?
Absolutely. I'll give you an example. When they kick people out right after surgery, or it could be when they're in the hospital, they'll say, what they'll do is they'll give them some education about what to look for when they're home. And then they say, now, if you have any problems, call 911. So it's not up to them. And then if they have any problems, they'll come back to the emergency room where they'll be evaluated again and maybe have some more tests, which brings in more income for the hospital. That's a cold way
Right.
of looking at it, but that's what's happening.
Yeah, it just starts the billing process over again. And
Right,
yeah.
exactly, exactly.
Okay. Um, very depressing. Okay. How, anything else on that question?
No, but I can understand that big sigh. It's like, oh my
Yeah.
God, how can this be? But I want you to know that there are so many nurses who are out there fighting this system. There are nurses who are joining unions, and the unions are fighting back. So we're working on it, but we need everybody to be educated about what's really going on.
What about lobbying? Does nursing have a good amount of lobbyists in Congress and
You
such?
know, I don't know if nurses have a lobbyist. I'm sure that insurance companies and pharmaceutical companies
Sure.
and supply companies, I'm sure they have lobbyists. And there's something else that's going on in nursing today in hospitals that wasn't there years ago, and that's the rise of private equity companies. Now, a private equity company, their whole purpose to be in existence is to make money. And so, what they try to do is they get investors to invest in their company. They are buying up hospitals, nursing homes, and emergency services because that's where the money is. And Harvard Medical School did a study, and they found out that when a private equity company purchases a hospital, a nursing home, or a emergency services, what happens is there's an increase in they cut nurses right away, they cut the staff. There's an increase in patient falls, an increase in wound infections, an increase in blood-borne infections, and an increase in adverse events following a medical or surgical procedure. Now, all that's horrible, and nurses are horrified by that. But what happens, and I'm sure this wasn't part of their plan, is that when you have people who are falling and um, having infections, then you have to do more x-rays, you have to do more lab work, you may have to do more tests. Those are all money makers. It's I'm sure it wasn't the
Yeah.
intent, but that's what the result is.
Yeah. I know that around where I live, there's been a lot of private equity buying up the
Yeah,
hospitals, and my
right.
primary care physician recently got sucked into that whole thing. And now all of a sudden, just to even have an appointment, it's all a big deal now.
Yeah, yeah.
Everything's
And
a
the
problem.
Right. Everything's a problem, but not for the private equity company. It's a problem for the healthcare. And what
Yeah.
we're seeing also is that the private equity companies are contributing to your politicians. So that's one of the reasons why everything is so bad. And then also, they're buying these hospitals out in rural areas that don't have maybe the income that the larger hospitals have, meaning that not as many of their patients are carrying insurance. They may be on Medicare. So they can't, their agreement with private equity is they can't keep up their end of it for those hospitals. So a lot of those hospitals are being closed because they're not making money for private equity companies. It's really sad. We need to get this word out there, and I'm so glad you invited me on your podcast.
Well, hopefully we will.
Yeah.
We'll see how things go. Okay, next question might be a little bit controversial, but
Okay.
have you ever known a doctor to be wrong? And if
Well,
so,
yeah,
would you
no,
do anything about it?
right. I know, you know, I never had an experience where I thought a doctor was wrong. I had an experience
Okay.
one time when I was working in chemical dependency where the doctor was really upset about something. I don't remember what it was. He was so upset. And he started to storm into the patient's room, and I stopped him. And I said, "Are you okay?" And then he settled down. And then he was able to go into the room. But as far as making a medical error, I have not picked that up. I've seen doctors who struggled with what to do and have called colleagues to get their opinions, their advice,
Hmm.
um, but nothing major like a big mistake. Yeah.
Okay. Okay, good. That's definitely something that's been on television shows. So I'm
Oh,
glad
of course, you
yeah,
get the readers, and then everybody's scared to death. Yeah,
yeah. No, no,
yeah,
I'm glad to hear that.
yeah,
That's good to know
yeah,
that.
yeah,
And I mean, I
yeah.
certainly wouldn't mind if they call their colleagues to confer on something. I
Right,
mean, why not?
right,
I mean,
right, right,
that's
right,
fine.
right. But
Yeah.
I will tell you, can I go into a little bit about what's happening to doctors these days? Are you
Yeah,
interested in that?
of
Okay,
course.
so, well, what's happening to doctors is that the old days, you went to your doctor. If you got sick, the doctor admitted you to the hospital. The doctor would come to the hospital to take care of you. It was your doctor who knew you, knew your situation. In today's world, with for profit, they have prevented doctors from coming to the hospital. So your own private doctor cannot treat you while you're in the hospital. They said, "We will have a hospitalist who is a doctor who will treat you while you're in the hospital." But the hospitalist doesn't know you. And so, two things. One is hospitalist has to order all these tests, which is a moneymaker. And then two, many hospitals are saying, "Gee, doctors are too expensive. So why don't we have a physician's assistant be in charge of you? And if we don't have a physician's assistant, we'll have a nurse practitioner who'll be in charge of you." And not only that, they give them way too many patients to take care of. So it's kind of a mess these days.
Yeah. Wow. Okay, Kathy. So you've worked in, like you said, pretty much every department in a hospital: medical, surgical, pediatrics, labor and delivery, ER, ICU, psychiatric units. I'd like to know more about that in a little bit. But what is something that happens in hospitals or has happened in hospitals perhaps in the past that would shock patients or shock people if they knew about it?
Right. Well,
And
I'm sorry, did I interrupt you?
oh, I was going to throw in there also, what was your favorite departments to work in? I'd be curious to
Oh,
hear what you
okay.
feel about
All
that way
right.
too.
Well, I think, when I was just talking about the poor staffing, it's really shocking to people because they go to the hospital and expect that they're going to be cared for. And with today's uh, poor staffing, and hospitals are doing this on purpose, they're cutting the care. And so that's the biggest thing I think that is going on in hospitals today. And just to know, nurses are fighting for you. And as far as my own personal journey in nursing goes, when I first got out of nursing, I did a lot of ICU and medical surgical nursing, which I totally loved because it gave me a chance to use my skills. And then I took a break and raised my kids. And then I went back into nursing, and I had an opportunity to work in a chemical dependency unit. I totally loved it. It was wonderful to see people coming back to life. And people would say, "Oh, how could you possibly work with those alcoholics?" Well, the thing of it is, you don't work with them one to one. They're in a group, they're in a setting, and you work with them as a team, and you help them find themselves again. So I totally love that. And then I've worked in locked and open psychiatric units. And I always have loved my patients. I could totally understand that life got overwhelming for some of these people. Um, I had I had a woman who was a paranoid schizophrenic, and she wouldn't talk to anybody. She was catatonic, which means she didn't move. She just sat in the same place. So I would go in every day and I'd introduce myself and I'd say, I just would like to sit next to you, but you don't have to talk to me. I'm just going to sit here. So I would do that every day for I don't probably weeks on end. And then finally, when it was time for me to not be in that unit anymore, I said to her, "I'm not going to be able to come and sit with you anymore, but thank you for letting me sit here with you." And she turned to me and she smiled. It was like, I've never forgotten that, to get that from a catatonic paranoid schizophrenic. It was like there was movement going on. There was healing
Yeah.
starting to happen, enough
Yeah.
to be able to trust the person she was with, to just be able to smile. And I've
That-
worked with other people who were catatonic. And one time I was working in the lock psych unit, and two policemen came in with a new admission. I guess he'd been quite inappropriate on the outside. And so I'm explaining to him, welcoming him to the unit and explaining things. And my voice, when I'm working there, I modulate my voice for this situation. So it was calm, it was soft, it was quiet, more quiet. And both of the cops says, "Gee, your voice is so nice. We'd like to stay too." So there's always humor. There can always be humor in everything. So anyway, I've liked every area that I've worked in,
Yeah.
yeah, and holistic nursing also.
Yeah.
Which holistic nursing is not traditional Western medicine. It's using other kinds of things for healings besides drugs and alcohol.
Okay. So yeah, why don't you just get into that? I mean,
Okay.
because you've got on here healing touch, energy
Yeah.
medicine,
Yeah.
and then somatic experiencing.
Right.
Is that
Right.
all tied to that?
No. Well, I was working in a psych unit at the hospital, and there was a flyer on the bulletin board saying that there was a healing touch class, and all you do is you put your hands on people and help them heal. So healing touch really came from something they called um, what is it, hands-on healing, laying on of hands. That's what it is. But this was adjusted to be appropriate for nurses to do. So I thought, oh, great, I'll do that. That'll be so much fun. So I took the class, and what I was shocked in my first class, that my student partner, when I did what they told me to do healing touch, her pain went away. I was amazed. This was incredible. This was back in 1992. And at that time, healing touch was sweeping the nursing profession. The nurses were crazy about it, and everybody wanted to do it. And so I became an instructor. I became certified as a practitioner, and then I became certified as an instructor. And I started teaching it. But in the later 90s, what we had was the hospitals were being gutted of nurses. So they couldn't be doing it on their patients. And also we got some blowback from the pharmaceutical industry. They supported
Can't
an
prescribe that.
article. Yeah, right. And that was very discouraging. They said there was no such thing as energy. There's no such thing as an energy field, which is what we were working with. Well, today,
So is that what you think? So that's what it is. I mean, can you explain a little more in depth as to what you think is happening?
well, what happened then or what's happening now?
Not with the industry, but with healing touch. With
Oh,
what is
with
what?
well, what's happening with healing touch is that the nurses got cut, so there's not so many nurses in the hospital. So, but we do have, the hospitals have now accepted that there is healing touch, and many hospitals have opened up integrative health departments where you can go in and you can have healing touch, acupuncture, massage, that kind of thing. So so people can make an appointment and go in and have a healing touch treatment at a hospital. And then
Okay.
also there are many people, many healing touch practitioners who volunteer at hospitals to go throughout the hospital and give people a treatment if they need it.
Okay. So what I'm trying to figure out, so scientifically, what do you think is taking place when you lay
Scientifically,
the
yeah,
hands
yeah.
on
So what's
someone?
happened is that they now know, they used to think, they used to think acupuncture was woo woo, that there was nothing to it. And then they thought that healing touch was woo woo, that there was nothing to it. But they've developed the kind of instrumentation that can test for energy fields. And so now they know that the body not only has an energy field, but it has a name. It's the biofield. They also know that around the earth, there's a geomagnetic field. So they have come to accept the idea that there are fields and that we can work with the fields to help people heal.
So a human being is putting out this bioenergy field,
Yeah.
and you're touching another human, sort of breaking into their energy field, and somehow there's a connection going on between the
Well,
two.
what we're doing is we're trained to put our hands in that person's field and then do an assessment. You know, every healing touch practitioner needs to do an assessment first. So they assess for what can you feel in this person's field. Now, if there's an illness there or an injury, you'll feel disruption in the field. If there's not, the field will be very smooth from the head to the toe. But
What
if
does a disruption feel like?
disruption can feel like heat. It can feel like a prickly sensation. It can feel like pressure. So you can clear that away with your hands. And then you know the person's been dealing with something. So what you also want to do, in addition to clearing away any disruptions that are in the field, you want to help that person have more energy to be able to have a balanced field and to be able to heal whatever's going on with them. So then that's when the laying on of hands or the hands on the body, when that step happens. So then what you do is you call upon the healing power of the universe to come through you. You're just a conduit. You're like, an empty flute, or as the Native Americans would say, you're like an empty bone where the energy comes through you to the patient. How you make that happen is that you have to have two things. One, your attention has to be on the patient, and your intention is for healing, no matter what that is. And sometimes the healing will surprise you. Sometimes it's something the patient had forgotten about and didn't even know about. But so now energy healing it's becoming very, very popular. And
So when religions have been doing laying on hands,
yeah,
I assumed it was nothing. So
right,
so it sounds
right.
like they were onto something earlier
Absolutely.
than okay.
Right. And what we're seeing today is more of a convergence between religious practices and science. And their science is validating the spirituality, and the spirituality is validating the science. Now, with laying on of hands, those people, when it came from a religious background, they were required to be of a certain religion, a certain faith. And that's not the truth. That's not the same with healing touch. And I will say, I trained with healing touch, which is for nurses. It came out of the nursing field. But there are also people who do things like Reiki. I don't know if you've ever heard of Reiki, but
I've heard of
that's
it. Yeah.
it's energy healing. And then there are other schools that teach energy healing besides Reiki. So it's becoming more prevalent today. And these are
And
things that people can do they can do it sometimes without drugs or surgery, but sometimes in addition to their drugs and surgery to help them heal faster.
okay, and you're also involved with somatic experiencing. Is that
Yes. Now
something
that's
related to this or
no, not
no?
at all.
Okay.
Not,
Okay. I see. I have no idea. I'm sorry.
no,
Uh,
that's okay.
you want to talk about that?
Sure, I'll tell you how that happened. I was working at the hospital, and this is in the 90s, and these for-profit changes were starting to take place. And I was working on the second floor. I looked out the window, and I saw the cleaning lady in scrubs discharging a new mother with her newborn baby. Now, that's the role of a nurse. In case anything goes wrong, the nurse will know what to do to help that mother and baby, keep that mother and baby from harm. I was horrified. So when I went to work, when I went to lunch, I saw a lot of people in the hallways who were in scrubs. And I asked them, I says, what department do you work in? None of them were nurses. Everybody was put in scrubs, no matter what department they were working in. And then a very authoritative looking woman came up to me and said, if I didn't stop asking people what department they worked in, she would call security and have me removed from the hospital. I couldn't believe it. I had worked at that hospital for years, and it felt like such a betrayal. But what it did is it triggered my own traumas. And I thought, oh dear, I can't do energy healing if my field is full of my own traumas. That wouldn't be ethical. So I decided I've got to heal my traumas and I've got to learn everything I can about trauma. So I studied with somatic experiencing, which introduced to the world an entirely new way of working with PTSD, a new way of working with trauma that did not involve you having to sit there and remember the trauma and be emotionally upset by it. It was a new way to work with trauma that dealt with what's going on in your nervous system, because it's the nervous system that rises to the occasion if there's danger or if there's a life threat. So I studied that, and then I graduated from there. I still continue to volunteer as an assistant in their training program. And then I graduated from 4 other trauma programs. But you know what? All of these programs were for psychotherapists who have an hour to spend in a nice quiet office with somebody who was traumatized in the past. Nurses don't have that luxury. They have very little time to spend with their patient. They work in chaotic conditions many times, and they and their patient may be experiencing overwhelming stress or trauma in the present. So I decided I've got to do something for them. And so I'm writing this book, and I've developed a program for them to help heal their overwhelming stress and trauma.
And the book is?
The book is Gutsy Nurses Save Lives.
Okay, so the Gutsy Nurses is somehow related to that?
Yes.
The
Yeah.
PT. Oh, okay. Let's get into
Yeah.
it. So let's
Okay.
talk about Gutsy Nurses.
Okay.
Yeah.
All right. Well, and this is having to do with another question you wanted to ask me too about burnout. Now, everybody believes there's only, do we have enough time to get into that now?
We have plenty of time.
Okay. All right.
4 hours. We're going 4 hours.
Fabulous. Okay. So, everybody believes that there's just one kind of burnout, but most people don't know that there's actually 2 kinds of burnout. One kind is when you're just working too hard, too many hours, no help, and you're swamped. And you have to do this day after day, and you just get so burned out. But the other kind of burnout is when you do the exact same thing as the first kind, only there's an added element. And that added element is that if you make a mistake, somebody could die. And in the case of air traffic controllers, a lot of people could die. So that's called traumatic burnout. And that's different. So that needs to be what that happens if you have traumatic burnout is the energy of that stays in your system. It gets trapped in your nervous system. Now, how you know that you've got trapped nervous system energy from overwhelming stress in your body is that you may be more irritable, you may be more reactive to people, you may use substances to help calm you down. And the substances can be anything from food to alcohol to drugs, anything to help settle your nervous system. You may have some disruptions in your relationships with your families and maybe not feel like going to the movies or feel like doing things, become more isolated. So, it can really affect people without them really being aware of it. Now, many times people will say, and I've said this myself, after a really awful shift, I've said, oh my God, I just feel so numb. Well, when you're feeling numb, that means that you've got traumatic energy trapped in your nervous system. So you've got too much.
So let's say someone goes home from work. They're an air traffic controller. They're a cop. Something, and they have what you say.
Yeah.
They have this built up stress.
Yes.
Other than getting drunk, which obviously a lot of people do.
A lot of people do. Right.
Is there other things you suggest to help?
Yes,
get it
there
out?
are other things that people can do. One is, first of all, know what's going on. Be aware of what's happening in your body. Now, with somatic experiencing, that works with the nervous system in the here and now. And so you can find a practitioner who will help you to release that from your body. Now, most therapies, when you have a release, it's a big emotional thing with crying and stomping on the floor and maybe hitting the couch with a bataka, something. But with releasing energy, trapped energy from trauma from your body is not like that at all. It's very, very gentle. And what people will experience is a feeling of heat going through their body and releasing. Or they may feel yawns. They may feel maybe some hiccups or some shaking. Or let's see, the shaking, or they may even experience some tears, because what they've been through sometimes is something that would any normal person would have tears over, not necessarily big sobs, but just some tears. So and they can start to get relief immediately. Now, as a somatic experiencing practitioner, I have said to people, I've been doing an intake on what's going on with them, and they start to tell me. And there's something called, there's some way, I won't go into it right now because it's another whole thing, but there's some way that you can feel what's going on in that person's body. It's like a sixth sense. I could feel when she was talking that her chest was starting to get really tight as she was talking about it. That tells me she's going into the trauma. So I said, you know what? I wonder if your chest is feeling tight. Well, yes, it is. I said, well, you know what? Your body went through this too. Not just your mind, but your body went through this. Your body's trying to tell us, gee, I've been through something too. So let's just take a minute. Let's just let your body settle down. Let's give it some time and honor it. And so then she would just rest for a few minutes, continue to breathe. And then when she felt that there was more expansion in her chest and in her shoulders, then we were able to go on with the interview. So that's what it's like.
I think I've read recently that it's possible when people experience surgery that they're experiencing some form of stress. Like, you don't remember it, but your body does.
Yes,
Do you do
yes.
anything about that?
Yes. Well, that can happen. And what happens for many people before they go to surgery is that they're presenting themselves for surgery, like, oh, I can handle this. But inside, they're really terrified and they wonder, am I going to make it through this? And so that's what's in the body. So that terror sometimes remains in the body. Not always, but sometimes. And so there's an easy way of getting it out. You can do some somatic experiencing and take that right out. Most nurses don't believe that they've got traumatic burnout. They don't even know about it. They just think that they're burned out, and that a lot of nurses are leaving the profession because the profession is so exploitive and abusive to them. And so with my Gutsy Nurses book, I go into what's happening to them, how they were able to be manipulated to participate in this new way of treating patients, how they've been reduced to data collectors instead of giving nursing care. And so I give them suggestions on how they can heal themselves, how they can, I'm just thinking of another thing. Not only heal themselves, but if they decide they're not going to work in the hospital anymore, I give them suggestions on who they can contact. There's an organization called National Nurses in Business, and they support nurses who want to go into their own business. A lot of nurses are starting coaching programs to keep people healthy. We're not going to change the system right away. That's going to take a while. But what we can do is we can dry up the market. We can
Yeah, you
keep
said
people healthy. Yeah.
you said on here, nurses everywhere are creating programs to help keep people
Yeah. Yeah.
people
Yeah.
healthy,
Right.
which
Right.
essentially dries up the market.
Right.
So
So,
keep going about
okay.
that.
So I'll tell you, well, we've got the Healing Touch program, which was started by a nurse. We've got the essential oil program, or excuse me, an aromatherapy program that was started by a nurse who healed herself of dengue fever using essential oils. So, that's a fabulous program. Then we've got nurses who are starting coaching programs. There is such a thing now. This is a new thing that's going on in the world today. There's light therapy. And then there's also sound therapy, which is helping people to heal. And also, we have to realize that normal life has been medicalized in order to bring in more profits for people who want to treat them. You create the problem, then, oh, I've got the solution for you. So this will give people who don't want to work in a hospital situation options for what they can do. But what about those people who work in the hospital and don't want to start their own business and who want to stay in the hospital? What can they do? Well, I developed something for them too. Actually, it wasn't me, it just came through one morning. I woke up. See, I worked in chemical dependency and I know about the 12 steps. Anyway, I wasn't working. I woke up one morning and it felt like something was coming through. So I grabbed a pen and a paper and I wrote down what came through. It was the 12 steps of healing care. And what it is, instead of working with a higher power like what an alcoholic would do, they're working with the healing power of the universe. And each one of the steps is applicable to nurses and how they can give better care. And so it teaches nurses how to detach from a system that overwhelms them in order to give good care. And it's a program that doesn't blame, anybody, we're not mad at anybody. What we're doing is we're taking responsibility for our own participation in this healthcare system. And we're changing it. We're not blaming ourselves either. These things happen. So, but we can do something about it. So hopefully we can help improve care in hospitals and then outside of hospitals.
Okay, I want to talk about just a second the stress you said that people like an air traffic controller might have inside of them from their job. I can tell you, I mean, I can't say for sure all air traffic controllers are alcoholics, but I know that there's a lot of people that soothe themselves with
Right,
alcohol when they come home from this type of job. I know
right.
that myself personally. I have, I've come home from work at 9 o'clock at night. I've got to go back into work in the morning,
Yeah.
but I'm so wired. Like I'm gonna have a glass of whiskey, like
Yeah.
to
So,
pull
yeah,
that
and you're
back.
wired because your nervous system, what they call a sympathetic adrenal response to stress, because you knew that you had important things to do and you had to be right on the mark to get everything done right, which is what nurses have. Now, what we're finding with nurses, some nurses, not all, but some nurses will have easy access to drugs. And so that may be the chemical of choice. My chemical of choice was food. Like, but a half a pizza count for resourcing. So anyway,
Yeah.
and then my husband was an air traffic controller, and what he used to settle his nervous system was alcohol. And he got to the point where he couldn't stop drinking. He was a really good, decent person, and he loved his job. He did really well with his job, but it was way too stressful, and the schedule was so isolating that it cut down on the possibility of other kinds of resources than just grabbing a drink, which was quick, which was easy, helped settle the nervous system.
Yeah.
So, and it had disastrous results. So, but
Yeah, I would
anyway,
imagine.
the thing is we need to settle the nervous system. And that's one of the reasons why I'm writing this book, because one of the things that people do when they're totally stressed out is they look at the face of the person who's caring for them. So if you're on a plane, for example, and you're experiencing um, turbulence, you look at the flight attendant's face to see, are we okay? Are we going to be all right? Now, if the face is really calm and relaxed, it's, oh, good, we're fine. But if the face is worried, constricted, tight, and fear in the eyes, you go, oh, we're not fine. The same
Yeah.
goes true in the hospital. If you're working and you've got a nurse who's taking care of you and her face is calm and relaxed, you feel good. You feel, okay, things are going to be okay. But if you've got a nurse who's taking care of you and her face is tight, constricted, there's exhaustion and fear in her eyes, people will think, oh, it's me. She's worried about me. I'm not doing so good. They may not think, oh, it's her working conditions that are doing this to her. Has nothing to do with that particular patient, but that particular patient doesn't know that. So what we need to do is to help nurses so they can work in an environment where they don't get so stressed out.
Yeah.
So, yeah,
And so if a young person, I guess they don't have to necessarily be young, but let's just say someone says, I want to be a nurse.
yeah.
They say that today. What advice might you tell them
Well,
to
I would
for
tell
that?
them that I think nursing is the greatest profession in the world. I think it's so wonderful. I mean, I've had a wonderful profession, and it's really helped me not only to help people, which feels wonderful, but also to grow as a person. So I would encourage them to get into nursing, but I would also tell them that um, the the healthcare system is terrible today, absolutely terrible, and we're working on getting it changed, but it may take some while. So anyway, to go and get the education they need to be a really good nurse, and then to find a job where the situation isn't so terrible, and maybe they have a mentor there that can help them grow and be a good nurse, and to know that systems are created by people and systems can change. So I don't know when this system is going to change, but I think there's enough people getting fed up with it that it will happen. So,
Very nice.
yeah.
All right. Final question. Everybody gets this question. What's a secret most people do not know about nursing?
Well, I think most people know that nurses really care about their patients and that they really, in today's hospital nurse, give up a lot, give up time with their family. What happens sometimes is administration will take advantage of a nurse, knowing that the nurse will come to work before they'll go home and take care of their family. So they schedule them too many days, and they're burning out nurses. But the nurses who are staying are dedicated to giving them good care.
Okay.
All
Kathy,
right.
it's been fantastic. I
Oh,
really appreciate
great.
you being on the show.
Yeah, thank you. I totally enjoyed it. I hope I gave some good information for your audience.
That was Kathy Allan, a nurse practitioner with many years of experience out in the field doing nursing. She's done pretty much all the versions of nursing there is. So I really appreciate her coming on. I learned a lot. I hope you did too. And once again, I hope you enjoyed the show. If you are just listening to this, we also have the YouTube version. The YouTube version has some animations and diagrams and some other things that you won't actually hear, obviously, in the audio version. So check that out if you can. If you like this content, please hit the like button. Maybe leave a comment down below and let us know what you think. And if you have an interesting job and you would like to be on the show, then email me, talesfromtheshiftpodcast@gmail.com, and I'll try to get you on here. Thanks. We'll talk to you later.